Hi, I'm Nancy Kaufman. I wanted to overview the Kaufman Speech-to-Language Protocol Kits 1 and 2. One of the reasons that I produced the kits was that they logically follow what we should do in therapy once we have information about what vowels, what consonants, and what syllable shapes a child has in their repertoire. So I have norm-referenced and standardized a test way back in the 90s, the Kaufman Speech Praxis Test for Children, that looks at just that. What vowels, what consonants, what syllable shapes are in the child's repertoire. So when do we use Kit 2? Kit 2 is more for complex articulation. It has some pivot syllables like ter, which we would use, we would pretty much pronounce it as der. For example, butter, or doctor, or computer, or heater, or motor. And then there should be water in here too. And we also have another syllable shape, pivot syllable of burr. So burr stays constant, and then we're going to be able to work on some multisyllabics like September, October, November, December, and how about cucumber or remember? So it's the same concepts as Kit 1, but much more complex articulation. There are final K words and initial K. There are initial G and final, initial G, front to back and back to front words, meaning words that start with an alveolar, like a T or a D, and end with a velar K or G, such as talk, dig, dog, or the opposite, words that start with a velar K, G, and end with an alveolar T, D, which would be words like goat, or candle, so that it's even a two-syllable word moving from velar to alveolar, or cat. Those are really important to work on because the children have the tendency to want the initial and final consonants to be similar to each other, and they may assimilate and make all of those, the TD to KG words, they might front them all or back them all. And the same thing with the velars to alveolars. There's also F initial, there's final F, there's S initial, final S, there's S blends, and R blends. And there's also SHs, SH initial final, and complex bisyllabics and complex polysyllabics, as well as ING progressive verbs. And what's important for those are that the children get the medial consonant. We're not so interested in them producing these words as barking. So EEN would be fine, barking, but what's more important is that they get the medial K into position. Just like it's important to get the simple bisyllabics and get those medial consonants in for bunny, happy, tummy, tuba, it's important to get the medial consonants in for present progressive verbs. There's not a lot on R in particular. There are R blends because these kits are about children who can produce the consonants and vowels in isolation but struggle to combine them. And therefore the R blends are in here for the children to practice brown, green, truck. But if they have difficulty with accuracy of R, that's a different level of articulation that needs to be practiced to gain R in isolation with accuracy and then combine it in all sorts of different contexts. So that could be a whole kit of R accuracy and combination words in and of themselves. So there's also a way to chart goals, and we might want to use a 4-point charting system so that when we're working on the different syllable shapes, let's say we're working on simple bisyllabics, the happy, bunny, tummy, tuba words, and we're going to assign a number per each utterance. So if the child requires full imitation and full cues, they might be auditory cues, visual cues, tactile proprioceptive cues, but if all of that helps them to produce the word, that would be a number 1. They would be assigned a 1. They would be assigned a 2 if they needed imitation, say tummy, but they only needed minimal cues. Minimal cues are visual only, such as an oral postural cue or a hand signal cue or a gesture. And a 3 would be where they don't get any imitation at all. You're just saying, what's this? But you're helping them with a minimal cue, a visual only. And they would get assigned a 4 if you just say, what's this? And they're able to name it spontaneously. So that's a good way to take some data when we're working on the different syllable shapes. And we also are really not going to just use drill with these cards. We really need to use some powerful and strategic motivating toys and activities to pair with the cards so that the children are motivated, happy, interested, and that you're also helping them with words that are pertinent to the toys and activities that we're doing as well. There are other materials that are associated with the KSLP methods that maybe also work on single words. Tammy Casper and my Sign to Talk kits are real photographs of items and activities that are highly preferred by children. They also have suggested approximations on the back. Sign to Talk is a whole technique to help children who really are not easily able to imitate vowels and consonants, and how to bridge sign language to vocal skills. There are a lot of other techniques as to how to help children to become imitators to then be candidates for the KSLP method. And then I also have some other materials such as the workout book, which we mentioned, and then also the Mutt Family Language Builder, which is a puzzle. And all of some of the simple bisyllabic words in Kit 1 are the Mutt family, which are associated with the KSLP methods, and their names follow simple bisyllabics like Toby, Mona, Heidi, Patty, and others. And then we can use those simple bisyllabic words as subjects when we're then moving into 2 and 3 word utterances. So I hope that you are excited about the KSLP products and that you are using them wisely. And if you want to know more about the specifics of the KSLP methods, there is an e-course through Northern Speech. That's northernspeech.com. You can get ASHA credit. You can purchase DVDs of the same KSLP methods. And then Tammy Casper does an amazing e-course through Northern Speech as to how to implement the KSLP methods, especially for those with autism spectrum disorders. So thanks for listening, and I so appreciate having the opportunity to talk about materials that I've worked very hard to perfect.